Oh, go live. Okay, that's live. Oh, fantastic. We've got some questions already. Guys, we are going to be going straight into it very shortly. On today's live, we're going to talk about this kind of this myth, this active myth. And hopefully it's going to be really helpful for some of you. I know there's a lot of people that constantly say things like, oh, I injured my back, but I've been active for a long period of time. I've always been active. You know, I didn't think I wasn't necessarily as strong as I needed to be. And they really struggle. And hopefully this live stream is really going to help a lot of you guys. I'm going to talk about kind of the two main camps that people typically fall into when they've injured their lower back. So this could be that you've got a herniated disc. It could be that you've got a minor back strain. It could be that you've got sciatica going down the leg. You guys, by and large, are going to fall into likely camp number 2. But I'll discuss camp number 1 as well as we kick off. And of course, guys, if you've got any questions, any comments as we're going live, post them down in the comment section. I can see there's a couple of comments that have already been put down there. So we will be getting into those comments very, very shortly as we go through the live session. Now, this first group of you guys that struggle with lower back pain, the strong camp, the individuals that have been doing strength training, for those that actually have been doing strength training and get the right advice, you've built good strength, physical robustness, and you get the right advice there and then when you injure your lower back, when you start getting that sciatica, maybe you push yourself a little bit too hard on a deadlift or something like that, you guys tend to do very, very well. But then there's a lot of people in that group, which is a smaller group, I would say. This is a very much a smaller group of people that struggle with herniated discs, etc. And you guys, kind of like Maya, for example, that we were discussing last week, I think it was, with reference to her x-rays. You guys, you injure your lower back, you've been at the gym, you've injured your lower back, you get the wrong advice, right? You go and see someone, they say, you shouldn't be doing any strength training, you shouldn't be doing any lifting weight, just do gentle stuff. And this group of individuals, some of you guys might fall into this category. You've got that injury to your lower back. You've injured something down here in the lower lumbar spine. Chances are it's going to be L4, L5, or L5S1 of the lumbar spine. And you get that advice to lay off, go and do, gentle movement, maybe go swimming, do some yoga, Pilates. And you guys, unfortunately, like we saw with Maya, that kind of train of events ends up weakening ourselves, losing all the hard work that we've done over the years, and we end up getting into a pretty bad place. And like we saw with Maya, it got to the point where she was practically bedbound for, I think it was about 2 years. And then when she joined the program, for example, struggling even to bear the weight of her spine, right? You can still come back from that. And she has, for example, is now squatting about 30 kilos on the squats, right? Barbell back in the gym, great. And that's what I always feel in particular for those people, because it's just, if you just give people the right guidance, who've been active at building strength, then they can do so much better. Laura's just said here, would you recommend Cobra stretches? For what precisely, right? Good question. If you've got a lower back injury, no, that's just a stretch. That's just another bend, twist, etc. Right? It might be that you find it relieving, but again, the right advice in the early stages is not to do bending, twisting, etc. The right advice is to stabilize the spine. If you've already in this first camp of individuals and you've got a bit of strength, you've been going to the gym, doing things like squats, etc., etc., then preserving that strength, maybe fixing some of your technical errors, is so, so vitally important. And if you do that well, you're going to do just fine. Then that moves us over to the second camp. And a lot of you guys that struggle with lower back pain are going to fall into this particular camp. And this is the individual who's not particularly strong, right? And we know we released earlier this year a podcast on strengthening a herniated disc. So for those of you that have got a herniated disc in the lower back, a disc bulge, a sequestration, insert special technical term here, an injury to the lower back, you can strengthen these discs. But as we referenced in that particular article and podcast, over 90% of you guys, in the UK anyway, do not partake in serious strength training of any significance for extended periods of time. And so it's fair to assume that 90% of people fall into this category. They're not really doing any strengthening work, and they're fundamentally lacking strength. And the reason this is so important is because if you don't have good strength, then when you injure yourself, you don't have a reservoir of compensation. If you don't have good strength in your leg muscles, etc., then when you injure your back, you can't abuse your knees for a short period of time while your lower back is going through a recovery process. A great example here. If you've got strong legs and you've injured your lower back, a great little tactic is to go down like so when you're having to pick that stuff up off the floor. But if you've got terribly weak thighs, which generally speaking, most people in this category will have, then you can't do this because you're going to end up irritating your knees. And often you'll even say something like, well, I couldn't do that, Mike, because I've got bad knees. No, you haven't got bad knees. You've got weak legs that led to vulnerable knees, that got injured, that led you to doing less, that caused more weakening in the legs, which led to more vulnerability in the knees and the lower back, etc. And so this puts you in a very, very difficult position. And that brings us almost full circle to this myth. Because some people in this category, unfortunately, and I really do feel for you guys in this category, because it's really bothers you up here, right? You say, yeah, Mike, I've been active. I did a lot of DIY. I was lifting things and moving things and this. I was strong. And the answer is no. No. Being active is not the same as doing strength building. And I think it's important to understand specifically what strengthening is and doing strengthening is, and why being active is not strengthening. And hopefully this is going to spell this out for you guys very clearly. And some of you guys can add in extra categories here if you wish, but fundamentally, I think it's fair to say there are 3 things you must have that the active person, for example, and make no mistake, being active is certainly better than not being active, right? You're definitely in a better position, but you're not doing strength training, right? And you're not building strength. And in order to build strength, you need to have 3 things. Number 1, you need to actually have a stimulus that is at the appropriate level to get change to happen in the bones, in the discs, in the joints, the ligaments, the tendons, the muscles, this area of the back, right? You need to actually have a stimulus. Now, we choose to create that stimulus in the program for rehabilitation of our spine by way of a squat and hip hinge in particular. The stimulus of the appropriate magnitude, so that it is relatively close to a degree of failure, but not enough to cause significant injury. We create a little bit of tissue damage that we adequately recover from. And that leads me to point number 2. You have to also have the stimulus with recovery. You need to adequately recover from these stimulus. And that's the body laying down tissue in response to the strain and building strength. And then the final most important part, and this is why the being active is not cutting it, you have to have consistency, regularity to this process. So I can't do my hard squats one time this week at the right intensity, recover well tomorrow, and then not do it for another 6 weeks, because that's not going to build and result in a strengthening outcome. Very important to understand that. So then we take the example, say, well, yeah, but I do these projects, I do this decking, I carry lots of, I was using this as an example, right? I carry lots of planks of wood, and then we build a deck, and it's hard work, it's physically manual labor. And the big mistake there is you confuse tiring work with effective strengthening. You get to the end of the day, and I will make no bones about it, you're exhausted, but that's not strengthening. You're exhausted, but that's not strengthening. And then we take the example of maybe when you're doing this active job, right? Maybe you're building a decking in the garden, for example. You're carrying tons of planks of wood, which might actually achieve that first category of strength, of close enough stimulus to what you are capable of doing. You're carrying those heavy planks of wood on day 1 because you've got to deliver the materials to site. But then the next 6 weeks while you're building the decking, you're moving 1 plank at a time, you're doing technical work, etc., etc. When you finish, if you're working at the right intensity, your squats, for example, you finish your set of 10 squats, you probably couldn't do 12. But how many times when you're doing your DIY, do you move that last slab and think, I couldn't move another 2? Of course you could, right? You carry on. So you're not achieving that intensity. And if we think about maybe the small scenarios where we're delivering materials to the site and we are getting close to that intensity, you're not going to do that again for another 6-7 weeks until you start the next job. So the characteristics of being active, I think often it's better than not being active in many ways, but it's not strength training. And hopefully that makes a bit of sense for you guys, because there's nothing worse than thinking you're doing something that you're not. Another example, which is I would suggest a little bit worse, is when people say, yeah, but my doctor told me I should do swimming for strengthening my back, or I should go walking to strengthen my back. And unfortunately, that's where you've been misled by a medical professional, and that's just there's nothing we can do about that, right? Hopefully that makes sense. But anyway, I'm going to jump into some of the comments, guys. We're here to help. So any questions on back pain, sciatica? I can see there's a bunch on YouTube, so I'm going to come over to those in a second. There's a bunch on TikTok as well, so we're going to run through these. And we'll see where we can go. So we had the comment from Laura about recommending the Cobra stretches. We always want to think about what is the objective, what is the purpose in mind. When we're doing Cobra stretches, we're just doing a backward bending stretch. As we saw last week on the live session, even when some of you guys are bending backwards, and I'll just quickly share the extras because I've got them up on the screen here. Even when we're bending backwards, see if that works. There we go. It did actually work. Even when we're bending backwards, we can see in this x-ray up here, we've got the backward bending curve of, I think it was about 32 degrees. Yeah, we can see at the top there, L5S1, 32 degrees. When the person's standing in neutral, 27 degrees of backward bending curve. We covered that in detail last week if you want to go and watch that live stream. But the point remains here that for a lot of individuals with a bad lower back, you don't necessarily know that you're doing the right sort of things. Now, some of you guys will feel relieving when you do Cobra, but the primary focus when you have an injury, when you have lower back pain, is that when you've got an injury here, the joint is injured, the structural integrity of the joint is impaired. And so we need to provide protection and stability for that joint. And as we go through the healing and strengthening process, normal movement, generally speaking, will return to the area. And then we have the additional confusing factor of the fact that you don't really know how much your back is moving. How do you know that that movement that you do when you do the Cobra is not just all hip extension and maybe some thoracic hypermobility? You don't know, and we can't know. And that's one of the big challenges with the lumbar spine. Holly Wilson says, but you don't recommend tucking in the pelvis. We do not recommend doing pelvic tucks. No. Posteriorly tucking the pelvis, doing a pelvic tuck, for most individuals is not appropriate and not helpful. And it's not the way in which we should be learning our core exercises. When we are load bearing in the upright position, and I'll just come back to the screen, bring back on the screen the x-ray so you guys can see. So it's very, very clear. Okay. Let's just share the screen again with you guys, right? Don't worry about the image on the right-hand side, but on the left here, we've got the normal spine. We should have a backward bending curve here, and we should have a slope. That slope is the slope that the lumbar spine sits on. When you do a pelvic tuck, you flatten the lumbar lordosis and tuck the pelvis under. That position is the position that we saw on the x-ray that you should be in. So when you're learning your core exercises on the floor, the reason people fail to understand this, the reason you are learning core exercises on the floor is because it is a safe, low-risk environment for you to learn the act of engaging your midsection. Why are we doing that? So that when we are upright, we can more effectively do it. But you do have to consciously do it. You are learning a skill that you must then apply, right? It's not just there that we do it in the gym or we do it in our rehab and then we forget about it. We're learning it here so we can do it here. And if you're learning a pelvic tuck to engage your core, you are learning something that is going to be problematic when you execute it in the upright environment. That is not what you should be doing when low back. You would never think of the cue. Okay, guys, we're going to lift something heavy. Let's first tuck our bum under and then engage, round our lower back and start lifting. No, of course we wouldn't do that. So why are you learning to engage your core by flattening your lumbar spine? It's not very well thought through. And there are reasons that that is often taught, but they are not reasons of concern over the spinal health. They're little hacks that help you do it, and you're learning a hack or a crutch that is not helpful. Sam says, can a slip disc be caused by poor hip mobility and strength? No, a slip disc is generally caused by an injury that occurs to the lumbar spine, a movement, an incident, but it certainly can be, those factors can certainly be a contributing factor, let's say. For example, if you have very poor hip mobility, most of the time and poor strength in this region, which basically is most people, by the way. So Sam's raising a very smart concept here. And that ties back into what I was talking about earlier with regards to most people are weak. Most people are weak from here down and maybe upper body as well, which means they don't move very well. They're lazy because they don't want to bend their knees and go up and down because they're weak, right? And so when they're living in daily life, they often are just abusing the lower back. And if their hips aren't very mobile and their legs aren't very strong and the buttocks aren't very strong, they're constantly rounding and bending the lumbar spine everywhere. And so that would be a precipitating factor, maybe a predisposing factor to constant repetitive strain on the lumbar spine. And then it's only a case of, well, it's going to go sooner or later. It might not have gone just yet, but it's going to. And then you find that your back goes when you were picking up a little model off the floor one afternoon or putting on a sock or reaching for a kettle, right? That was the final straw, so to speak. But that certainly wouldn't challenge a healthy back. You had a repetitively strained back. So it's important to mention those things, the weakness in the hips, the poor mobility in the hips. Those are the things that we address within the program. Make no mistake that if you're doing your squats and hip hinges correctly, you are building strength at the level of the hips and strength at the level of the midsection. So you are rebuilding all of those things. Holly says, but if I wasn't to tuck my pelvis when hinging, then my back is not neutral. If you tuck your pelvis, Holly, when you are hinging, you are not doing it correctly. A hip hinge is a movement that does not involve the lumbar spine. A hip hinge is this. There is no pelvic tucking. There is no lumbar movement involved here. A hip hinge is just that, a movement of the hip socket and the hip socket alone. There should be no involvement of pelvic tucks, of pelvic twists, of pelvic bends or lumbar bends. The reason it is called a hip hinge is because that is the only thing. You are a drawbridge for that moment. Your entire spine fuses, and the only thing that is mobile is your hip socket. That is when we are doing a correct hip hinge. If we are pelvic tucking, then we are doing things very wrong. Kyla says, do you think a 14-week pregnant woman can heal a L5 herniation, or will it just get worse? It's more tough when you have a pregnancy. As you start to go through the pregnancy progress, maybe you've still got a little bit of time in this regard to benefit from things like the towel decompression, but you can't lie on your back, you just can't lie on your tummy. It gets a little bit more difficult. Now, some factors for some people, they find that the actual extra layers of flexibility that you have during pregnancy, because of the laxity of ligaments and the changes that take place, maybe that will help you, right? Just do the best. You have to do the best you can. And that's just the way it is, right? You have to do the best you can. Learning to move better is always going to be a help, Kyla, but you do the best you can, right? You're not going to be able to do everything that the people that aren't pregnant can do. For example, the towel decompression, but there are other ways you can do it, right? For example, on this chair here, I can sit on it in reverse. Let's pretend you haven't got a tummy just yet, I'd imagine, at 14 weeks, okay? Or not significant anyway. And you can lean on the front here. You can get into a neutral spine, and you can just support your body weight on here and create a bit of decompression by pushing up. And you would lean and contact this chair in whatever way is appropriate. And this can be quite a relieving thing, because I'm able to press down on my arms on the sides of the chair. I can create a bit of decompression. It's very gentle, very easy to do, right? Obviously, you need a specific kind of chair to do that. And I wouldn't necessarily go out and spend the money on that chair to go and do that for one, but you can replicate that kind of position using your dining table chairs, for example, as well, to help you create that little bit of decompression. Arguably, if you got literally like 3 dining table chairs, one that was here, or maybe 2, one that was here, and you had your arm over the back on one side and your arm over the back on the other, and you create a little bit of decompression by just pressing down on your arms to lift your body. That could be a helpful way of just creating that little bit of decompression without having to lie on your tummy. Those can be quite helpful. Acacia says, you literally saved this 18-year-old girl's back. Thanks a lot. Oh, that's awesome. Thank you for sharing. Appreciate that. I don't know what we've done, but hopefully it's been the content on the channel that's been helpful. Jackson says, lower lumbar lordosis, best way to help it. If you have a lower lumbar lordosis, Jackson, that is normal for a human being. People don't understand, right? And I'll just go through to recap it for those of you that haven't seen this before. This is a normal human spine here. I'll just remove some of the rubbish on the screen, guys, so you guys can see. If anyone tells you you have a lumbar lordosis, ignore pretty much everything they say after that, because they're evidently either don't talk in specifics enough, or they're just throwing out words that they don't really understand, which would be a shame. This is a lordosis. This is the lumbar spine. Okay, we've got the individual vertebral box. This last one here is L5. This is the sacrum here. It is a triangle-shaped bone. Got 2 hip sockets here. You've got the bum over here, the lower back here. The tummy is going to be out here somewhere, okay? You'll notice these bones are arranged in a curve. The green line maps the curve. That is called a lordosis. That is perfectly normal for a human being to have. It has a value to it. You can measure the curve. If you take a line and you extend along off the back of the top vertebra and you extend along off the bottom vertebra, you can measure this angle, and that gives you a rate of curve. It should be around about 40 degrees. That is completely normal. You should have a lordosis. Now, whether you've got too much of a lordosis or too little of a lordosis, that's a conversation that one can have. But generally speaking, that will probably have been discussed in context, or in the context of an injured lower back. So focus on the actual injury. and then we can go from there. Dawn says, I'm about to have lumbar 4 to sacral 1 fusion with instrumentation. I hope it goes well for you, Dawn. Make sure that you've got the appropriate support from a rehabilitation point of view. Very important. Akasha says, I stumbled upon your channel on YouTube. That's awesome. Thank you. Yeah, so very, very, very valid comment here. So Acacia says, I went to therapy and they told me to stop going to the gym back then and it made me feel worse. I think if you've got a lower back injury, you do need a bit of guidance. That's very, very important. You need to have some guidance. It's no good just going to the gym. You do need some kind of structured rehabilitation strategy. But being discouraged from doing actual rehabilitation work rather than being given guidance is a big mistake. Just coming over to YouTube, we've got an Instagram. We've got my leg muscles are considerably atrophied since I got the herniated disc. Can you tell me how to reverse it? You should be doing that. You should be doing the rehabilitation work, the strengthening work. That is exactly what we are doing. We're doing our squats, our hip hinges, our step ups, our single leg hip hinges. Warrior Jungle, if you're not in the program, check it out. Get started. Youth Club says, where should we feel it whilst having just the primary back, glutes, and core? Because I heard physiotherapists said you should feel it in your glutes primarily when engaging the lower back as well. Not too sure what the context of this question is, Youth Club, I'm afraid. Daphne says, slowly getting better with 2 bulging discs and sciatic pain. Every time I do rehab exercises, I start feeling sciatica in my legs and my legs get weak. Am I doing too much too soon? Yes and no, Daphne. If assuming that you're doing the sort of rehabilitation that we talk about, spine stability work, this is very, very important that you guys understand this. If you're doing the right rehab work, you should be doing it aggravation-free, which suggests that, let's just suppose you were doing a squat and you noticed that you were getting the pain in the from the sciatica going down the legs as you're doing this exercise. That indicates that you are doing it wrong. You are maybe rounding your lower back, you're bending, twisting in one way or another, and you are aggravating the injury down here. Your reps should be aggravation-free. And sometimes people will go, ouch, 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 ouch. That hurt my back. Squats are bad for my back. No, 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 no. Squats are not bad for your back. Doing whatever on earth you just did is bad for your back. Doing a careful, controlled squat is not bad for your back, right? And when we go about exercises, unfortunately, and this is a real error, because you see this judged by the way in which people frame it. You need to be a student of the rehab. You're not just doing an exercise, go and do it, you know, like turn on the light switch. You just go over and turn it on and it's done. You should be seriously going about your rehabilitation work in a reflective manner, thinking about precisely what you're doing. So when you do a squat and you go, it hurt when I did squats, that's not an answer. That's not what happens. It hurt at a specific moment of the squat. And there's context around it. So I currently have no pain. And when I stand up, I have no pain. And when I start squatting, I have no pain. But when I got to here, I started to experience pain at this specific point. Why? I've started rounding my lower back or on the hip hinge. At this specific point, I experienced pain. I wasn't in pain here, and then I wasn't in pain here, and then I was in pain. So then we can look at precisely what happened at that moment. That's how you troubleshoot if you've got a lower back issue when you are doing the rehabilitation exercises, because the sorts of exercises that we talk about, spine stability work, should be done without the spine moving. More or less every single time, every single one of you experience pain or aggravation, it is because you moved the spine. You moved the bit that's injured. When you were still, it might well be throbbing and it might well be painful, but as you moved in one direction or another, and strain went specifically through that section, that is when you experience the pain. Because if you don't move it, it won't hurt. Now, it might be throbbing as a result of the aggravation. It might be, the pain might now be there as a result of the aggravation. But by and large, people are not in pain all the time. They are in pain most of the time. They are flaring things up most of the time, maybe. They're going flare-ups most days they experience pain. But the details really matter. And so we have to explore that when we are doing our exercises in order to get useful information. So going back to Daphne's question, am I doing too much too soon? No, you're probably doing too much of the exercise, or you're doing it in a way that is not reflective. And therefore, we're not looking in a detailed manner enough to find where precisely we failed to control the spine and sticking within our zone of competence. It might be that we just haven't watched a tutorial video. We haven't learned how to do it correctly. And that's one of the reasons why I say, guys, you don't just go to the gym and work out. Have a plan when you're going there. Berto, thanks for the hearts. Roy says, I do 5 exercises to help with knee pain or just lower back pain. Do the 5. The dead bug and marching bridge less so, but certainly the squat, the hip hinge, the step up and the single leg hip hinge, you are building lower limb strength. You're building strength basically from here down. I mean, arguably, you're building strength from basically like your chest all the way down. You are building strength in all of those areas. How do you correct bladder issues due to a herniated disc? If you have any kind of bladder disruption, Janet, you need to get that checked out. You need to get that checked out. Once you've been given the all clear, you need to do the rehabilitation work. But you need to get those things checked out. Nirava says, hamstring feeling okay today. I think maybe the depth RDL helped loosen them up a little bit more. Nice. On my squats, I mentioned in a comment, that's what happens by removing the depth day for squats. Do I then get to 60 kilos and then remove the block? Then just the bench and reduce the weight. So let's say 30 kilos, and then no, for those kind of bits, do a post in the members area because it helps me have the context a little bit more. So if we're talking about that kind of deep strategy, but what I think you're saying is yes, get up to 60 kilos and then start thinking about pushing the range of motion after the 60 kilo point rather than before. Hope that makes sense. Nick says, what is the best for dehydrated discs, L2 to L5? It is windy out there today. New bulging disc, but not on a nerve. And we've got Bertolotti syndrome. So guys, what is Bertolotti syndrome? Bertolotti syndrome is a form of sacralization of the lumbar spine, typically speaking. The way in which we are born is that the L5 is a separate vertebra to S1. S1 is the first of 5 fused bones that make up the sacrum or the tailbone, if we include the coccyx, which is down here. For some individuals, during their development, parts of the L5 or all of the L5 may well be fused with the sacrum in the same way that S1 is fused with S2 and you can't distinguish it as 2 separate bones. This happens to a varying degree. Sometimes people have what's called a pseudoarthrosis, which basically means a fake joint between this bit here, the transverse process of L5, and the side of the sacrum here. Fundamentally, this is often just a distraction. And the reason I say that is you've had it your whole life. It's a relevant distraction, right? Because to the degree that it's maybe fused, we've got one less segment that's mobile in the lumbar spine. And maybe it's less mobile, a little bit more so on one side than the other. Maybe one side is completely fused and the other not. Maybe it's just fused on the back of the vertebra and not on the front of the vertebra. I don't really know the details. And do the details really change what you do from a rehabilitation point of view? No. But what I will say is important is that individuals like this who then get given extra bending and twisting exercises, I think they do very poorly. And what often happens in someone like Nick Devon's circumstances is that she might injure her lower back, have bad treatment for an extended period of time, bad advice, comments, etc., finds she's getting worse, feels like she's at a loss, has a scan, someone goes, you've got Bertolotti syndrome, and then, oh, well, it's that. But it's like, no, that's been there the whole time. And it's used as a bit of a scapegoat to explain why you haven't got better. And the answer why you haven't got better is because you haven't been doing spine stability work. You've just been trying to bend and wiggle in a circumstance where we actually have one less segment that's mobile than the others. And so often you're then creating a little bit more hypermobility in the other segments if they're moving very much at all. We don't know, right? This is one of the reasons why stability work is so very important and so very helpful across a broad range, if not the broadest range of individuals, whether we've got people like mentioned earlier on who's having surgery and multiple level fusion, or whether we've got Nick who's got this quagmire happening at the lower lumbar spine, a congenital issue that's been there her whole life, by the way, or whether we've got someone else who's got a more minor disc bulge. If you just learn to control this section of your lower back, you will do an awful lot better. And if you rebuild the strength of this area, you will do an awful lot better. Miss Emma says, how long will it take for a disc herniation to heal? Your discs are going through a healing process every single day. For some people, they will find that they can mitigate the aggravating factors of daily life very quickly and can find that they feel better within a matter of days. They can massively reduce the number and severity of the flare-ups that are occurring to where their symptoms reduce significantly. Others, they perpetually aggravate the tissue over months and years. But typically speaking, muscles will adapt to a stimulus over weeks, and the ligamentous tissues, such as the annulus fibrosus, which is what you fundamentally injured when you have a herniated disc, right? You've injured the annulus fibrosus, which is why the disc bulges back. They heal and respond and remodel in matters of months. So we want to understand how far along that recovery process we are. And the big mistake that a lot of people make is that they go on how they feel rather than the strength of the actual tissues. So for example, I take my knee, the meniscus, right? It stopped hurting pretty quickly, right? But the meniscus cartilage is slow to go through a healing process and scarring up, etc. Just because it stopped hurting, part of that was because I stopped aggravating it and was able to strategically move in such a way. But I know full well that it's not re-strengthened. Now, how do I know how strong it is? Because how it feels is irrelevant to that process. This is where your rehab comes in. Coming back to the lower back. If you're doing proper spine stability based rehab and you're leveraging exercises, the most important, like the squat and the hip hinge, you have an intimate understanding, to Miss M's question, of how healed your herniated disc is. It's healed enough to bear 5 kilos on a squat. It's healed enough to bear 20 kilos on a squat for 10 reps without any aggravation. It's not healed enough to bear 30 kilos. I know, because the last Tuesday afternoon I tried doing 30 kilos and it hurt. It didn't feel good. It felt like I was too vulnerable. That's the power of rehabilitation. It helps you understand what's going on. And as if on cue, Janet said, do squats aggravate the sciatic nerve? If you do them wrong, and it's important to understand they're not aggravating the sciatic nerve. Again, we're thinking about things in an inappropriate way when we talk about squats aggravating the sciatic nerve. Squats aggravate the spine and the injury that is there, that then might result in irritation of the sciatic nerve. Your sciatic nerve is not the injury. This is one of the important paradigm shifts that those of you that are still talking about your sciatic symptoms need to go through. You need to get away from sciatica and understand very clearly that your sciatica is a second order consequence of the injury in your lower back. The sciatic nerve and its nerve roots are right in there. They don't just randomly get injured. They are injured by something perhaps irritating them chemically by way of excess inflammation and congestion in this space, or directly being hit by the disc bulge, which is, I would argue, less common. There are many more of you that say I have sciatic symptoms and I had an MRI and they said I had a disc bulge, but it wasn't hitting the nerve. Yet I still have nerve-like symptoms. Go figure. Why? Because when you have an injury to the disc, you will often get a lot of inflammation around that area, which irritates the nerve, especially when there's congestion that fills this small space where the nerves come out, which is now smaller, by the way, because there's a bunch of disc material in the way. So it's important that we talk about these things in an appropriate way, because if you think it's just a compression of the sciatic nerve that is the problem, you will do things, logically speaking, perfectly reasonably so, that try and alleviate the pressure on the sciatic nerve. Well, what's the most obvious thing to do? If there's pressure on this sciatic nerve because the space is being, or the root of the sciatic nerve, I should say, sorry, then we just bend forwards and boom, the pain goes away because I made this space larger. Well, if we know that the sciatic nerve is not the problem, that the injury is the problem, then we know that that's a bad thing to do, right? And that's why education is so important when it comes to lower back issues. Warned by Jude says, can I do the rehab exercises and start running 7 weeks post-op? I would suggest that's not necessarily the smartest move. I would suggest doing the rehab work, building strength and resilience up to a reasonable level. What's reasonable, Mike? Well, we can talk about that, but up to a reasonable level with your controlled exercises that don't have variables in them, such as the squat, the hip hinge, the things that we talk about in the program, right? And then start reintroducing running. We had one of the members that's reintroduced park run recently, 5K, did it in under 30 minutes. Very, very exciting, right? Immediately wanted to go next week, and we decided maybe that's not necessarily the best approach. But how she got into running again was using the treadmill. So how you choose to do that, warned by Jude specifically and others that have a herniated disc, that have maybe had a microdiscectomy, that want to get back into running, I think that can be perfectly reasonable, especially if running is something that you're going to do for decades to come. Absolutely reasonable, maybe even healthy for the disc, one could say, especially if it's done correctly. But how you get into it matters, right? So my suggestion for getting back into running after you've had a herniated disc or some kind of injury to the lower back or had surgery is going to be that you start off on a treadmill doing short durations. I'm talking about 30, 60 seconds, maybe 90 seconds to 2 minutes max, at a pace of 10 kilometers an hour or faster, and doing sets of that. Maybe you do 3 sets to start with. So literally maybe 3 lots of 30 seconds, 30 seconds running, 30 seconds rest. Why do we say do that inside? Because I think it's safer. Setbacks affect people, especially after a surgery or a severe herniation, up here often significantly more than they affect you down there in the lower back. And so I've been for a run around the block. You probably have too. Running along, minding your own business, and a car pulls out of a driveway, right? And if you can get onto a track, different story, right? But most people can't. A cat ran in front of you and you suddenly had to stop. There was a little bit of a bump in the road and you tripped a little bit and lost your footing. That's got nothing to do with running, but then that caused a flare up and it made you think, oh, I'm never going to get back to running again. Whereas if we're doing it on the treadmill, we are controlling the variables much more tightly. And so that allows us to get the confidence back, build up some momentum with the running alongside our proper rehabilitation that we've already made some good progress on, and get back into something without unnecessary risk of pointless flare-ups that affect us psychologically significantly so. So hopefully that makes a bit of sense. Emma says, any suggestions for sciatica and anterior pelvic tilt? Ignore the fact that you've got anterior pelvic tilt. Unless you've had, and I will share this on the screen again, unless you've had someone go onto your images, this is a set of x-rays of the lumbar spine. We discussed them last session, right? Unless you've had someone go and do a bunch of measurements like this and measure the actual angle, sorry, that's a massive blob, okay? And actually measure things and giving you numbers specifically, not a physical exam, unless they've actually done it properly, ignore the comments about an anterior pelvic tilt because they're said all the time. And we've done literally the last couple of x-rays we've done on the live sessions. Those specific individuals have been told they had anterior pelvic tilt and they actually have posterior pelvic tilt. Physical exams are basically useless for inferring these pelvic tilt situations. If you've got sciatica, you've got an injury to the lower back. By and large, it's an injury down at L4-5 or L5-S1. That's the segment that's generally injured. So learning to stabilize that region of the spine is the way forwards. That's what we do in the program. What else we got? Nyla, I think. Sorry if I've butchered the name. Says, after doing squats, I feel pain in my knees while sitting and standing, and it was not before. We might well be squatting. So as we mentioned earlier on, a lot of you guys, the largest camp, to go back to the start of the live session, the largest camp of the two that you guys fall into if you've got a lower back injury and you are recovering is the camp of individuals that do not have appropriate levels of strength and resilience in their body in general. And so it is extremely common for those of you who injure your back to have weak thighs and weak buttocks, which is why you're not very good at the squats, which is why when you do the squats, you're going like this, okay? Which is why when you do the step-ups, for example, you're going like this with the knees. Which is why, quite honestly, when you get out of a chair, you do this instead of using your legs. This is one of the important reasons, there are a couple, but one of the important reasons why we structured the program the way in which we do from phase 2 onwards, and that we have the 2 separated routines. Because for some individuals, the weakness in their legs pre the back injury has resulted in injuries to the knees, substandard health of the knee joints themselves. And so you realize that actually we need to have a strategy for being able to address the knees as we're going through the process. So when you're doing your squats, for example, you only squat to a point that does not aggravate the knees included. And that gives the legs time to catch up in their ability to perform the squat without aggravating the knees. And what in that time, you're pushing on with your hip hinges to make further progress for your back. Other people notice the opposing situation. They need to leverage the squats a little bit more because they struggle more with the hip hinges. But the important thing is that you should not be aggravating things, period. You shouldn't be aggravating things. And this is why we have support in the members area, because people run into these challenges when they're doing these exercises. They run into these challenges and they sometimes need a little bit of guidance. And so guys, if you are struggling and you've been struggling for a good while, then do check out the program. There's links for those of you guys watching on TikTok and Instagram. There's links in the profile pages, or just send us a DM. That's probably easier. Kyla says, only because of a hot water bottle. I don't know what we're talking about there. Guy says, I've been training glutes, hamstrings, quads, deep core, and ankle mobility. I see no improvement on hyperlosis. I assume that Gaj has a back injury. What you've been doing for glutes, hamstrings, quads, etc. is important. And what you've been doing for deep core is important. You'll notice that we talk a lot more about training the movement. For a lot of you guys, you struggle to perform a simple squat or a simple hip hinge with good form to start with. And too often there's this obsession with talking about specific muscles, the piriformis, the glute medius, the this, the that, the other. If you just, for the ordinary person, it's often a lot more effective to focus on a movement. If you learn to perform a squat or learn to perform a hip hinge or learn to perform a single leg hip hinge, you are learning to use muscles correctly and in concert in a way that is good movement practice, let's say. If you start talking about trying to do the glutes and trying to do this, you end up doing things like glute bridges on the floor or clamshells and other sorts of things. You end up using isolation exercises that are kind of a waste of time. It's much better off if you're doing those sorts of movements that we talked about, the squats, the hip hinges, the single leg hip hinges. These exercises provide you a mechanism to work all of the relevant parts. They are also extremely applicable to daily life. They also, because they are principled, you should be maintaining a neutral spine through all of them. You're unlikely making mistakes in the pursuit of isolating XYZ muscle. For example, you might be trying to vigorously stretch piriformis, and so you get yourself into a figure 4 position and you hug that knee towards your chest, rounding your lower back, violating the principles of a neutral spine in the pursuit of stretching a tiny little muscle. That's a mistake. If you focus instead on moving through the squatting range of motion, or moving through the hip hinge range of motion, or going through the single leg hip hinge, you're going to be working all of those individual muscles, taking them through a stretch whilst still focusing on the neutral spine. And you'll find that everything starts to improve. Janet said, what is the best exercise to strengthen your core and pelvic exercises? And are pelvic exercises good? The exercises that we talk about to help you completely recover from these lower back injuries, post-microdiscectomy, herniated discs in the lumbar spine, minor disc bulges, right? All sorts. Predominantly, these are in the lower section of the lumbar spine, L4-5 and L5-S1. The exercises are the dead bug, the marching bridge, the squat, the hip hinge, the step up, and the single leg hip hinge. But the mistake that a lot of people make, those are the ones that we use in the program. Many of you guys will be familiar with them. Those are the ones that we talk about till I'm blue in the face on the channel here, because you don't need 1,600 different exercises. These all hit you in every single different way, right? You've got 2 exercises that you can do on the floor. So even the most vulnerable of you that are like, Mike, I can't get out of bed, I'm stuck in bed. You can start doing simple versions of the dead bug and the marching bridge on your bed. You don't even need to get out of bed. You can stay there, lying, watching your phone, right? Like that, in bed, and practice the dead bug and the marching bridge, or easier versions of them, right? So they're accessible to everyone. You can make easier versions, you can make harder versions. Then you've got the squat and the hip hinge. Those are movements that you do literally every day. So that person who's bedbound, everybody who's not bedbound, you're doing these and more, right? But even that person who's bedbound, maybe like Gaj, who says he or she has got a spondylolisthesis, right? Or a listhesis, right? You're going to get out of bed, even if you're bedbound, you're going to get out of bed to go to the bathroom. So you're doing a squat, right? Well, a squat works all of the muscles down here if we recruit them correctly when we are doing the exercise, if we actually engage our core, if we actually drive through the legs and we come up to the upright position. If we get out of our bed by, oh gosh, my back is so bad, well, no wonder you're rounding it like a fish hook, right? But learning that movement is vital. Same thing for the hip hinge. The single leg hip hinge and the step up then create this asymmetry. They challenge you in this asymmetry position, right? As you go lower over time through the single leg hip hinge, as you're in this position and you're holding weight, you're twisting. You shouldn't be twisting, but you've got torsional forces acting on your body that you're working against as you go through the hip hinging motion, the single leg hip hinging motion. So you've got every single angle in these 6 exercises. And you've got the ability to build the load bearing capacity through the addition of load, maybe using a barbell, but certainly in the first instance, using dumbbells or kettlebells to help you. That is how you build strength, but always observing a neutral spine. Dark Wolfer says, what if your lower back is pushed inward and you have to round your lower back? You don't. And I don't know what that means there. All lumbar spines should be pushed inwards because we should all have lordosis. Often we get this scenario where people start to think that ordinary features of human anatomy are problems because they've got a back injury. They start pressing around that area. A great example of this is with the neck, right? When people have neck pain, all of a sudden they realize that this bone here sticks out and they think there's something wrong with them. But they've never stopped because they didn't have cause to do so before to actually lean forwards and go, goodness me, that bone sticks out. Why? The C7 and T1 vertebrae are large prominences. They are much larger than the smaller vertebra spinous processes in the mid part of the neck. They stick out. And when you turn your head forwards to feel the pain in your neck, you realize they stick out. The same thing for the lower back. People very rarely go digging around this area, but there are superficial soft tissues there. There are bony bits, and people think there are problems there when they start digging around that area. But this is not where the actual problems are. They're just bony bits that all of a sudden might well be sensitive because that region is sensitized. We start thinking there are problems there when there actually aren't. Because those areas, these areas of our body, the back generally doesn't exist in your mind until you have a back injury. So you've never been forced to look at it, touch it, poke it, prod it in any real detail until you have a back injury. Especially when it comes to the superficial things on the surface, the bony markers, etc. Adrian says, I still can't thank you. Oh, cool. I still can't thank you enough. Still without pain. Just feeling sciatica now and then. Adrian, make sure that you are still building strength and stability. Continuing to progress. Once we get, so this is a target for those of you that are a bit further on. Once we get to around about the 100% body weight on the squat and hip hinge that we can perform aggravation-free every single time without any aggravation of our symptoms, especially for the guys anyway. Look to the hips. Do we have adequate hip mobility? Do we have adequate hip mobility? Bossing 08, everything we've been talking about is tips for herniated discs in the lower back. The whole thing. Adrian said something interesting. I tried some jumps and it threw my back a little bit. One of the things that we want to understand is that we build up this good starting point, this good scaffolding, if you will, as we go through the rehabilitation. But then when we go to do something else, we have to realize that we have to try and make these things a little bit sport specific. So for example, a couple of months back, I shared with you guys, I started trying out paddle, right? Some of the guys were doing paddle. And I was like, yeah, I'll go along. Be fun. It is fun. I'm not conditioned for paddle. I do jiu-jitsu, right? And even after a fortnight off jiu-jitsu, you feel it, right? You feel it when you go back in. Even though you're strong, you guys do need to be smart in the way in which you then approach getting into some other activities, right? If we're going to start doing leaping and bounding stuff, get into it a little bit more steadily and allow your body the time it needs to adapt to a slightly different kind of strain. If we want to get into running again, that's why we give those strategies out. If we want to get back into golf, we build up a good foundation in our rehabilitation of strength, fundamental strength and stability. We maybe work on the hips a little bit more as well, of course. And then we get into some sport-specific pursuits. Maybe if it's jumping, maybe if it's this, maybe if it's that. We get into and we ease ourselves into those activities. We don't just go in completely blind and push ourselves too hard. Now, the good news is if we do inadvertently push ourselves a little bit too hard, like Adrian might have done, because he's got the good foundation there, you go back to the same principles, you rebuild, and then you test it again, but you test it in a slightly smaller dosage. Dark Wolf says, I couldn't walk for 8 months. Now I'm doing calisthenics and creating space by stretching downward. The big problem with calisthenics is it has no loading component to it, generally speaking, or no easily scalable, in a simple way, loading component. That's one of the things I'd say was missing from calisthenics. That's not to say you can't use that as a tool in your rehabilitation, but you need to have a progressive load-bearing exercise baked in there. So maybe you do calisthenics with squats, or maybe you do calisthenics with hip hinges. That'd be cool. What else we got here? Is it okay to walk every day if you have a herniated disc? It's perfectly okay to walk, but you need to understand what walking is doing and what walking is not doing, and if walking is aggravating you. So walking is great because it creates a little bit of movement through the lumbar spine, which helps with congestion in the lower back. It helps drain things. The reason that a lot of people feel particularly bad first thing in the morning with their back injury or their sciatica is because congestion builds up overnight in these little holes where the nerves come out and makes things particularly sensitive first thing in the morning. As you get up and you walk around in the first 20 minutes, half an hour to hour of the day, you start to feel a bit better because the congestion has been eased. So walking in that respect is helpful, but it is not strengthening. Sometimes surgeons, doctors, other professionals in the healthcare space will make the cardinal sin, the significant error of saying that walking is strengthening your back. It is not, because as we discussed earlier, to strengthen something requires three things at the very least. It requires that it is actually at the appropriate level, close to, proximal to failure. The intensity matters. So does the recovery, and so does the frequency of doing that. And walking does not have that intensity metric being met. You're walking for a relieving factor. However, some of you will have limitations on the walking because it is a load-bearing activity. And so because you've injured a load-bearing tissue, there might be a load intolerance so that you can only walk for 10 to 15 minutes before things start to get problematic. Some of you, it's 10 to 15 steps when you start. And so you walk within aggravation-free limits for that herniated disc so as not to cause unnecessary irritation of the lower back. But you've got to make sure you're prioritizing your rehab. You have to make sure you prioritize your rehabilitation work. If we don't do that, then we'll get into trouble. Roy says, when I do hip hinge, I don't feel my core muscles working. I feel painful cramping in my abs. What's wrong? We're definitely doing that wrong. Roy, I would have a look at the program to get a little bit more guidance, a little bit more structure in what you're doing. Because I know you've been on quite a few of these lives. I'd check it out. And use the support to work through it. What else have we got here? My doctor said, don't walk for long. Don't jump and don't play basketball. There should be no, generally speaking, there should be no long-term prohibitions, if that's the word. But there should be no long-term prohibitions. There's nothing you fundamentally can't get back into. It's just a case of, have you done the appropriate rehabilitation to enable you to, with reasonable confidence, know that you can get back into that thing? And then how are you going to get back into it? That's the important thing. And then you can do whatever you want, right? You can do whatever you want if you effectively do the rehabilitation work. That's the important caveat that people often don't acknowledge. Kayla said, how many times a day should you be doing the exercises? And kind of following on from that, Worn by Judas is, how long is the rehab needed? And those are three very good questions. With regards to how often you're doing the exercises, if we think about the rehabilitation exercises, so that's what we would call phase 1, 2, 3, and 4 in the program. You start off doing those every day because you need to learn how to do them. And that requires some effort. You might be recording yourself, etc. Right? But at the end of the day, if that puts you off, then I'd ask you, you're obviously, there's some real issues there. If the fact that you have to put effort into learning these things puts you off, then I'm tempted to say, are you really in that much pain, right? When people are in a lot of pain with back pain, they'll do whatever it takes to get better. So the answer should be, where do I need to start, right? So effort is required to do these things properly. So you need to learn correctly, which means it's going to take a little bit of time. And that then means there's two cases in that scenario. One case is where you are literally bed down and you're really struggling, you're not able to go to work, right? For you, you got all day. So spend all day doing it, right? And that doesn't mean all day doing exercises. So for example, when people join the program, there are almost 100 educational videos outside of the program. And then you have 7 or 8 strategy videos before you get to the tutorial videos. So you can watch all of those, right? You're not even doing any exercise. You're just learning at that point because you're very, very vulnerable and you want to take it slow. Fair enough. But you've got plenty of time. So you go through all of that education because that's really going to help you. The other people, the other group, well, you're still working. You still put, okay, well, in that scenario, you've got to make time for your back. Because if you don't make time for your back voluntarily on your terms, it will force you to be one of the category number 1. It'll make you make time for it on its terms. And that's not the scenario that you want to be. That's not optimal. But you take as long as or as little as you want, but you need to be doing those exercises every day because you need to learn how to do them correctly. And if you imagine you had a young child who's maybe 1 year old and they're trying to learn walking, would you say, no, you don't do walking practice every day? We'll only do it every 3rd day and we'll only do it for 5 minutes. No, of course you wouldn't. That's silliness, right? You learn. If you want to get better, you learn faster. You learn, you practice more. Now, the exercises to start with, for example, it's standing against the wall. It's learning how to stand upright, engage your core, right? It's learning how to engage your core, which you might be doing on the floor or on the bed if you're in particularly bad. So you practice that. You watch videos, you practice, you watch videos, you practice. You learn how to do that. Beautiful quote says, I work all day. What else? I have 3 kids at home as well. That's tough. That's tough. So you do the best you can. You do the best you can, right? What's the other option other than do the best you can? The good news is if you do the best you can really make some real improvement. But it's tough. Everybody has different circumstances, right? And I really do feel, having one daughter that's just over 3 and one daughter that's just over 1, I really do sincerely, and I mean this, feel for those of you guys that have herniated discs or injuries to your lower back that either have very young children or maybe the pregnant ladies among you, right? It's tough. It really is tough. But you've just got to work harder. Sorry, that's the only logical answer. There is no other option. And you can do it. You can. But you just need to be a bit more disciplined. You need to try and factor in time. You need to try and learn these things as quick as you otherwise can. Right? That's the most important thing. It really is. And if you really engage in the educational material, then you're going to do okay. If you start applying skills, so for example, when you're putting the kids down, right? If you've got a cot and you're putting the kids down, you're bending over the cot to put them in every night. Change that. You can change that. See if there's something you can do. Maybe you can lower the cot slightly so you can more effortlessly put the child down. Those things can help, right? Little modifications. Education can play a really big role because the education is the bit that you guys don't look at often. Education is the bit that informs you. So, hey, I wouldn't do that if I were you. So, oh, I didn't even realize that was a bad thing to do. I'll be more conscientious going forwards. Just looking at some of the other comments here. Adrian says, my left leg is constantly in pins and needles. Adrian, what can you do to make the pins and needles worse? It sounds like an odd question, but it gives you important information. Now, as we're doing the rehabilitation work, as we get better at the rehab, we do it less frequently. We do it less frequently because we need to recover between sessions. But that's much more what we would call phase 3 and phase 4, when you're actually working harder. Just looking through some of the other comments, guys. Everyone says epidural pain doesn't go away. It's permanent. I'm not sure what the context there is, but with regards to epidural injections, because people often ask, you know, what about injections, right? Understand that when you've got these injuries, for example, to the disc, this is the healthy, nice little disc in the lower back. You see, we've got the fluid in the middle, and then we've got the layers of ligament that are on the side. These are the annulus fibrosus. They hold the fluid in place. When you have an injury, herniated disc, you break through some of those layers. When it's particularly bad, you break through a lot of those layers, right? When you have an epidural, it does precisely nothing for the damage to those tissues. That's a very important thing to bear in mind. The rehab is the work that you should be doing. Now, you might have discussions with regards to epidural injections or nerve blocks, etc., and those kind of things, but they should always be discussed with rehabilitation work. CPP Salm says, I have a grade 4, 5, grade 1 unstable spondylolisthesis. Can I exercise? You can do rehabilitation. The important question here is, were you sent home after you got the diagnosis to go and do whatever you do, right? And the answer there is yes. Exercise is, unfortunately, for those with back pain, it's something that you guys sometimes view of, incorrectly so, as scary, worrying, etc. Exercise is just activity that has a goal attached to it, right? So your exercises should be, for example, spine stability exercises, like a dead bug, marching bridge, squat, hip hinge, step up. We've talked about them, right? That is focused on improving the ability to control and protect that spondylolisthesis, right? Bear in mind, you are doing activities all day. Everything else you do that's not actual rehab, that is goal orientated, is activity without any focus whatsoever. You getting dressed in the morning is activity. You going downstairs to have your coffee or breakfast in the morning is activity. You going out to work is activity. So if you've been you going home from the hospital or doctors or clinic after you got the diagnosis of the grade 1 spondy at L4-5 is activity. You got in and out of the car on your own, maybe in pain, maybe not. So I'm saying all of this to help you understand that you're doing activity every single day. All your rehabilitation exercises are a focused, goal-orientated activity. Activities that you're actually paying attention to, activities where the focus is on making sure this is protected, because getting up and answering the doorbell is not one of those activities, but you're going to do that probably later today, right? Or getting up to go to the dining table to have lunch or dinner, right? Is something you're going to do. So don't be unnecessarily fearful of principled rehabilitation work. I've got a beautiful quote that says, I fell from stairs in my childhood, age 12, back pain. It's still there. I can't sit longer without support. Sometimes some of these childhood accidents are tough. They are tough and they linger. But if we work through and build strength, that is something that we can do. Alicia says, would you consider walking with a backpack of 10 to 15 pounds as a way to strengthen my lower back? I also do the other exercises you recommend. Not really. One thing we're interested in the program is making sure that we have a very clear set of criteria to move on. Easy ways of inferring the amount of load we've placed on the spine. And that's why the squat and the hip hinge in particular, 10 reps with a given weight, it creates the easiest and most simple way for most people to in a very accessible way, assess their current level of loading, assess their current level of performance, and assess how much load they've actually put through their spine. If you walked with a 10 to 15 pound rucksack and you walked out and around your block, one of the days it might have been particularly blustery, so you kind of buffeted around a little bit. Another day it might be particularly wet, you slip a little bit. Another day you might have walked a little bit further because you had to do a detour. Another day you had to stop suddenly because someone was pulling out of their drive. It's much harder if you're using that as your primary kind of load-bearing thing to use that to effectively meet the criteria of strength training, which is a stimulus at the appropriate level. And you don't know if you're necessarily doing too much. It's hard to gain those things. Is it too much as well as the other things that you've done? So I would suggest leaving those kind of things out for the short to medium term. Do I think that doing some kind of loaded walking is necessarily a bad thing? No, not at all. I think that could be something that could be helpful for you in the long term. But I think when you're in the early stages of recovery, of rehabilitation work, and you're building your squats and you're only using 10, 15, 20 pounds on the squat or hip hinge, I think you're too much of a beginner to be worrying about that kind of stuff. The chances are that you're more likely to go and do too much, right? And actually affect that recovery, which is important. Jurek says, how often should we be doing squats and hip hinges? Is every other day okay? It depends entirely where you are in the recovery process. As I mentioned earlier, sometimes you're starting out, no, not sometimes, all the time you're starting out, you're going to be doing those things daily because you need to learn how to do them correctly, right? But then as they get to a certain level, when we're squatting or hip hinging with a reasonable amount of load, you're going to be doing them less frequently, right? Some of the members, they're just doing them twice a week. They're doing 2 heavier sessions a week because that's what they need to do. They're working at a sufficient level to actually challenge the tissues, and they've started feeding in other bits and pieces, and that's the right amount. That's where we're aiming for, right? But you have to put in the hard yards to actually get there to that point. And if you're still messing around with 10, 15, 20, 30, or even 40 pounds, you're not there. You're not there yet, unfortunately. Worn by Jungle says, when starting a rehab program, do I still need to do physiotherapy? I'm living in Amsterdam. It's what is physio, right? We did this discussion a couple of weeks ago, right? What is physio? I don't know what your physio actually is, right? Your physio could be actual rehabilitation work, right? Chances are it could be rehabilitation work, like what we talk about, right? It could be that you're just going to physio and they're doing treatments, right? There could be hands-on treatment physio, that style of things, right? Perfectly reasonable. It could be rubbish physio, where you're just given a sheet of exercises. Like when we did this chat on one of the she said no, it's really rubbish. Then why bother, right? Just because it's free doesn't mean it's worthwhile doing, right? Just because, like, we pulled up the sciatica exercises from one of the NHS trusts. One of the exercises, I kid you not, was a quad stretch. It was this is a back pain. This is one of the exercises that they had on there. That, right? So if it's that kind of physio, that just gives physio about. I'm an osteopath. But that gives physio. But I'd be furious if that was physio, because so many people say And he says exactly that, right? So many people say, oh, I did physio, like, and I tried physio and it didn't work for me. And they assume that means that rehabilitation exercises won't work for them. And that's not the case. Pretty much 100% of people that have ever joined the program have done physio of some description before they join the program. And what are they doing? The exercises I've mentioned to you guys. What are they getting? Better, right? It's not just about exercises. It's about doing them in a way that actually works. If you do squats, an exercise that we talk about, and you do 10 reps of squats and you do them badly, you're going to hurt yourself and make yourself worse. If you do squats and you do them correctly and you do this 10 squats and you do 10 squats 3 times a day for the next 6 months, you're going to go nowhere. You might well make some progress, right? Because there is going to be some technical benefit, but you're not building strength. You're getting to the point where you're just wasting your time and creating a false sense of security. Then you're really annoyed. You're really annoyed when, I'll just try and bring this up wherever it is. Then you're really annoyed when you flare your back up because you say, oh, well, I've been doing the squats for the last 6 months. It's like, yeah, but you've been doing 10 squats 3 times a day for the last 6 months. That's not strength training. That's not strength training. So, guys, we've been going for an hour. I hope it's been helpful for you guys, those of you that have joined. Today is Thursday, so we will actually be live tomorrow. It's going to be earlier, probably around about 11 o'clock tomorrow UK time. So those of you guys that need any more help, you can check out the website. If you're over on TikTok, just send us a DM. If you're on Instagram, send us a DM. We'll point you in the right direction if you do need more help with your lower back pain, with your sciatica, with your herniated discs, etc. Those of you guys on YouTube, again, you can comment down in the comment section and we'll get you a link if you need a little bit more help. And guys, thanks for all the questions. Thanks to all of you that joined live. Sorry for those of you on here that I didn't get to your questions. But again, if you need help, you know where we are. And those of you that are members of the program, again, if you need help, you know where to go. The members area on the website, that's where we help you guys every single day. So until next time, guys, have a great afternoon. And thanks to all of you that joined. Bye now.